Hello. For anyone who's just joining us at this point in the day, welcome and thank you so much. You've come for the session on sustainability. So yeah, I'm really excited to have that conversation together with you all. I hope everyone's managed to get themselves a wee cup of tea, a cup of coffee, a glass of water, a can of Diet Coke if you're like me. And I hope you're enjoying the session so far today. As with all the sessions, this one will also be recorded, but I'm conscious it's 4 p.m. You've been with us all afternoon. And often the thing that we need most is probably not another Mentimeter at this stage, but a little bit of an engagement activity. So I hope that you will humour me in turning on your screens for like a little engagement activity we'll do just to get a sense of, yeah, where people are and what they have around them at this moment. So yeah, if people could just pop their screens on, that would be fabulous. The more there are, the less embarrassing it is for everyone. And Pavi also reassures me that it's usually the person who's speaking at the time who shows up on the recording. So it'll only show me looking like a bit of a wally whenever the recording comes out. But yes, I wondered if everyone could put their hands on their head if they're wearing slippers right now. So if you're wearing slippers, I am. Could you put your hands on your head if you've got a pet in the room with you?
Yeah.
This is mainly my way of trying to get people to show their pets to me. So if you want to show your pets, you're welcome, but don't feel like you have to show your home environment. Andrew was up immediately like a greyhound. So maybe he's got a greyhound in the room with him. Oh, there's Andrew's cat. Hello. Oh, we've got a cat with Caroline there. Any other pets on the screen I've missed? Oh, lovely. Can you put your hands on your head if you have received or you're expecting a delivery during today's session? Amazon are making the big bucks today. Oh, we've got a dog there. Hi, Jenny's dog. That's a beautiful dog. Thanks for sharing with us. Oh, wow. Can you put your hand on your head if you're on your second or more hot drink of the day? Coffee and tea fans here, I can see is maybe hot chocolate fans too, but don't want to assume. And can you hold up your hand just next to you if you're in an office today? Very good. A lot of office dwellers today. I can tell from people's backgrounds, like beautiful wallpapers, and that's lovely wallpaper you've got there, that some people are at home or else in very nicely decorated offices. And can you put your hand up if you are sharing your workspace today? Lovely, jubbly. Well, I hope whoever you're sharing it with hasn't had to listen to me too much today, but hello to them, if so. Thank you so much, and thank you for humouring me. That's always appreciated. Now I'm just going to hand over to the chair of our next panel, and that's Merryn Simpson, who's Chief Executive of the Health Creation Alliance. Over to you, Merryn.
Thank you, Sarah, and thank you everyone for your tenacity and staying with the programme today, because this final session is about sustainability of the programme, and Bola mentioned this at the beginning, and it is incredibly important. I'm sure that there isn't anyone on the call today that doesn't agree with me on that. This is a nationally conceived and nationally funded ground-up programme. And so far, it's been very successful, and that bodes really well. But what happens next is critical, because the national funding will wind down, and it will be up to the groups together, the ICBs, the ICSs, to take the mantle. And there's a lot at stake. There's a lot that could be lost if we don't set the conditions now for long-term sustainability. There's funds that have already been spent on the programme. There's the trust that's been built with community, and there's the loss of opportunity for transformation for the NHS and social care, which certainly at the Health Creation Alliance, we think that the connecting is at the heart of the wider transformation. And so this session is about that, and about how integrated care systems and the national team might set the conditions for the long term, so that the Connector programme doesn't just continue, but that it thrives and grows and continues to develop. And so that the connectors become seen and play roles as part of the system, not separate from the system. And so that they can be a real positive and constructive change part of the system. So we've got 3 speakers for this session. Not much pressure then on our speakers, but I do know each of them now, and I'm sure that they're going to enlighten us in a number of different ways as to how this might start to shape up and how this continuity and sustainability piece might look. So I'm going to introduce them one at a time, and they'll do 3 or 4 minutes, and then we'll start to have a conversation about what this means for the ICBs. So first off, I'm going to introduce Thomas Herveyer from Southwest London Southwest London Integrated Care Board. And Thomas is the Transformation Manager for Long-Term Conditions and Community Empowerment. So tell us, Thomas, how this is looking from the Southwest London Wave 1 site. How's it looking from your perspective? What have you and colleagues learned so far? And how are you thinking of sustaining the programme going forward?
Thank you, Maren. Thank you for the introduction. So yeah, you introduced myself already, so that's really appreciated. Just to give you a bit of context, Southwest London applied to become a connector site as part of the Wave 1 of the programme. So we're now heading into year 3 of the programme. So we've got a couple of years of learning that we can sort of build on. And we've learned a lot from those first 2 years. Obviously, we've had some learning already as well from programs that sort of preceded the Connectors Programme. But I think, and it sort of goes back to what Bola was saying in the first session, it's like it really all sort of revolves around trust. And we know that there's often been a lack of trust in some of our Core20 communities. And it really takes time to build and sustain that trust within their same communities. And again, it requires time and a consistent presence of those trusted connectors that we've found within those communities. It also revolves around community empowerment and sort of really sort of building the infrastructure and capacity within those neighborhoods and the communities. So building the capacity of those connectors and the people around them. Making sure that they've got the skills and the tools to lead on interventions themselves, and making sure that people are empowered to really manage their own health and well-being where that's possible, and supported by the wider system around that. I also think a big realization for us has been that it's often not health that their own health that people are worried about. It's often more about, their housing situation or their economic situation, and obviously over the last few years, we've seen the cost of living crisis and how that impacted our communities. And obviously we know that those wider determinants of health have a massive impact on people's physical and mental health. And I think it was Michael Mohammed, if I'm correct, who said that we're treating people in hospital, but we're sending them back to the same circumstances and conditions that made them sick in the first place. So it's really trying to make sure that we do things about that to make sure that people don't have to end up in hospital again and unnecessary. Obviously, the program is at the moment a fairly low cost program, but I think everyone can agree that it has immense value, and the connectors play a massive role. In that sort of more primary prevention kind of side of things, if you like. And it's how can we make sure that people don't reach that sort of cliff edge where they do need to then, if we don't empower them before, and if we don't make them less dependable on our primary care services and secondary care services, and increase that health literacy and increase their opportunities to make sure that they can manage their health and their well-being. So across our 6 boroughs in Southwest London, we've implemented the Connectors Programme, but it's really been a platform from which other initiatives and projects have sprung as well. And it's really building that community ecosystem and really looking at neighborhoods, but then also connecting it with the sort of wider public health ecosystem, and making sure that communities together with voluntary and charity sector organizations, but also with the NHS, the council, public health organizations, really work together, and they're making people aware that we're all doing this together as one and we were talking about it. It's like an integrated care system, integrated neighborhoods that we all want to talk. We'd like to talk about, but we really need to make it a reality. Just to go back to the sustainability bit. So in Southwest London, obviously the funding, as Maren you were talking about earlier, is ending soon from the national side, but this is the second year in a row that we used some of the Inequalities funding that came from the national team to continue to fund the Connectors Programme. As I said in the beginning, it takes time, and you're not going to see the changes that you want within 1 year or within 2 years, but we really need to make sure that we fund this properly. And we can't make the same mistakes of starting a project and really building that trust and capacity, and then leave it again, and leaving the same communities with the same sort of trust issues that we started with in the beginning, basically. So yeah, I think that's the really important thing to note there.
Thank you, Thomas. I mean, you've said so much in that short space of time that
trying to
there's loads of points there, and it does sound as though you personally, and I wondered if you feel that the system, the whole of Southwest London, has reached that tipping point where you have realised that it's a platform for many things. You certainly seem to have done, and also, you're the only ICS or ICB speaker today. So, do you think, what would your message be to other ICSs, other ICBs?
I think it's as I said, it's making sure that people are aware of the work, obviously, that's happening, and making sure that it's not just I'm gonna phrase this. We need. As I said at the end of my little bit, I think we can't just make the same mistakes as we always have. We've done our projects. But we need to really it's showing that it works, and it's making sure that as a system we make sure that we can continue this, and we need to look at how do we shift some of the funding that goes to programs potentially right now that's it's shifting that into community and into into that sort of prevention bit, if that makes sense.
Indeed, thank you for mentioning the funding again there. We'll come back to that, but for now we'll move on to our next speaker, who I'm delighted to be able to introduce, Samira Ben Omar, who I suspect many of you will already know, Director of Samira Ben Omar Associates Limited. And Samira will talk, I think, a little bit about how to sustain community action on health inequalities, and drawing on her experience from working with the Grenfell community in the aftermath of the terrible tragedy. Thank you, Samira.
Hi, thanks, Maren, and thanks for that introduction. And you can see I'm incredibly imaginative and creative with my organization's name, in calling it Samira Ben Omar Associates. But yeah, so thanks for inviting me to join you and to talk about the work. I think, I mean, I've kind of edited and re-edited what I was going to say probably a good few times, having heard the conversations that I've had throughout the afternoon. But I suppose for me, in terms of how we can make things sustainable, and not only sustainable, but self-sustaining, is how do we kind of mobilize and actually kind of create that shift within communities to mobilize. And I think for me, there are kind of some key things, either kind of ways of working or preconditions for that to happen. And that kind of requires our system to step into the in-between space. So to actually kind of move out of their organizations and step outside of their organizations and work with communities differently. I think in terms of empowering communities are already empowered. They're not waiting for permission to actually be empowered. I think there's something about ceding powers and handing over power to communities. I mean, we heard Bola earlier saying that the community has the most sustainable and self-sustaining solutions. So how do we actually acknowledge that, not just in terms of our strategies and our plan, but also how is that reflected in the funding that we provide to communities to really do and deliver that? And how do we do that? There's something about starting with a conversation. I mean, the power of conversations to really kind of generate change is really quite important and critical, and also in how we honor the stories that we hear in the way that we heard them. We heard with Khadija and Asma earlier about actually how some of the services were provided and actually they just didn't fit the reality of people on the ground. So how do we actually kind of start with the reality and actually kind of develop our strategies that are rooted in the reality, the daily reality of people's lives? So I think those are quite important. There's something about actually how do we not only challenge the system, and how do we challenge and hold each other accountable for what the issues are, and how do we actually kind of make that a way of generating wider conversations. Early on in this particular program, there are a lot of challenges in developing and co-producing the specs for that. So how do we actually kind of continue that approach, and how do we learn from that approach and develop that? And the second is, how do we actually make sure that the tools we use and develop and deliver to measure impact are not just the traditional if you like, programmatic or structured approach, but more kind of emergent, more relational, that really connect to people's lives. And they require different tools. They can't actually kind of be done through the traditional established tools. So I think that's kind of in terms of how we work differently with communities and how we see the power over to communities, because they know what works for them. So our role is to really facilitate that space and nurture that space to enable for that to grow. I think for me, in order for that to happen, we need to also kind of almost reverse the telescope on our system. We know that the kind of system, if you like, is kind of, there are some, if you like, some institutional and some structural biases that favor data and analysis. They favor clinical solutions. They favor traditional hierarchies. They favor tools for evaluation. So how do we then actually kind of really, while at the same time working with communities, we're also really working to actually kind of shift the way the system actually kind of does things. So how do we actually give parity of these things to the stories that we hear, not just to data analysis and analytics? We need both, but I think we just kind of need to give the other actually equal weight. How do we make sure that prevention, early intervention, and working, connecting differently around what matters? Health doesn't happen in isolation. You know, the biggest impact you can have on health, as Thomas says, is your wider, your social determinants, your housing. If you fix housing, you can fix probably about 80 or 90% of health. So how do we actually kind of begin to do that? How do we use different tools to actually kind of measure that? And also, how do we then begin to generate? So not just go to the evidence-based solutions that are already established. How do we create our own and generate our own solutions that are kind of almost, so it's kind of turning the evidence-based practice on its head, and actually kind of say, how do we build a practice-based evidence? So we really kind of begin to generate our own evidence. And I think this type of program and the volume of the programs across the country, if we bring them together and look at the collective impact, it gives us a really, really kind of strong evidence and case for change to do this more and do it at scale.
Thank you, Samira. Incredibly powerful. And while Thomas touched on the funding, you touched on the measurement and the data and the quantitative and qualitative, and using different ways of working. We'll maybe come back to that as well, because Bola did say at the beginning, didn't she, that we need to measure, demonstrate impact, tangible impact. But what that looks like is, you know, different from what ICS and the NHS is used to seeing. So let's come back to that. So I'm going to introduce a third speaker now, and this is Sally Yeoman, CEO of Halton and St Helens Voluntary and Community Action. And Sally, it's great to have you here and to see you again. And you'll be talking a little bit about building the work of the Connector Programme, I think, beyond the programme, but through the VCFSE sector. And how the connections there might help to sustain this. So looking forward to hearing what you have to say. Thank you.
Thanks, Maren. And I feel like the three of us maybe have been given the question that you avoid answering on your funding application, in terms of what does sustainability look like. Not dissimilar to colleagues who've just already spoken, in terms of some of the learning and using the learning from the programme really to try and influence what happens next. So very much in Halton, we believe that the work's been successful because it's been embedded with the voluntary community, faith and social enterprise sector via us as the local infrastructure organisation. And one of the things that we could think about in terms of sustainability is that it continues to be rooted through our sector, because that creates the connections and the connectors in a way that, you know, as we know, voluntary and community groups already do. We, importantly, I think one of the things that we are attempting to do is to use the learning to influence and shape the thinking at an ICB level. So Thomas touched on influencing the way money was spent and thinking about the investment that we know is already there around health inequality and health equity. But making sure that we use the learning from the programme and the successes to make the case for investment in programmes like this, or in this as a methodology, as opposed to something that requires funding separately, but should be really key and critical to the system. You know, our approach around utilising external funding. So I think one of the things we've been able to demonstrate in Halton is that this work, connected to work that's going on in other bits of the borough around the National Institute for Health Research, indeed working with Merrin's organisation and Lloyds Bank Foundation to embed kind of principles that we want to work with, not just as a separate programme, but the way we work as a system, and making sure that resource, and we make the case for external funding. And indeed, Halton's been one of the successful places around the lottery's health equity fund. So using that to talk to external funders and internal funders about how this works and how we should continue to work in the way we have been. And then I suppose I just wanted to say a little bit about what I think. So those are already changes in our place, but importantly, the principles that have been developed and that we've been using and working with as part of this programme have already been embedded in our One Halton strategy and are key to the delivery of our wider determinant subgroup, which I happen to be the joint SRO for. And I think those are two really important things when we start to make the case for continued investment at place. Really importantly, from our point of view, that our very local place-based arrangements see the value and the benefit of the work that we've been doing and intend to influence at a Cheshire and Merseyside level, which is where some of the decisions will get taken in terms of future investment, but not waiting necessarily for the ICB to come up with that, making sure that we are utilising the learning and talking to people where we can about this approach.
Thank you, Sally. So actually you talked a little bit there about being sort of an ambassador, but more than an ambassador, being being a communicator to the system, an influencer of the system, and thank you for those connections. And we've heard a lot, I think, from all of you about the sort of the momentum that's been built up in a number of different ways within the community, within the VCFSE, and also within the ICB in Southwest London. So actually, I don't know if you want to bring the other two speakers onto the screen now, and we'll have a bit of a conversation between us. And also, I'm conscious that Pavi or may have some questions. So in a couple of minutes, I'll come to any questions that are coming out of the chat. But for now, we'll just have a little bit of a conversation. So Sally, you mentioned external funders there, Lloyds Bank Foundation, others out there. To what extent do you think it's it's important for the community and VCSFE to bring that extra money in? And to what extent is it more appropriate for the ICS to fund this? So the funding is the crunch, isn't it? It does need some money. It doesn't need a lot of money, frankly, but it needs some money. We all know that. And this sort of activity that we're getting through the Connector Programme is high value for communities, and it's life-saving. But at the same time, it's not necessarily seen as high value by systems historically. So how can we get this high value stuff understood and bought into? And does that come, do you care about what you fund, or is it appropriate to bring resources from other places? I'll just put that one out there and see what the speaker have to say.
I mean, that's a huge question. I suppose one of the things that I suppose what I was attempting to say was, as you said, the legacy and the learning from this provides opportunities beyond health, doesn't it? So beyond looking to the ICB to resource it. I'm not saying we shouldn't be doing that, but we should. So from our organisation's point of view, one of the things that we think we've been successful on the back of this is getting a 3-year programme of investment from the lottery through their health equity programme. We definitely use the principles of that, making the case for the sector and its role, and I think that's been hugely beneficial. And so Halton will continue to benefit from that, but St Helens is also in terms of our work, and it's part of being involved in this programme, and the opportunity to think about the way we're delivering helped with that. I've got no doubt about that. So it was that's one of the things I think is useful from a Halton perspective. From my point of view, what I'm really keen to see is that there are a set of approaches and principles, methodology indeed, that we would be taking from this programme, and we should be asking commissioners and funders via the ICB to invest in the methodology, not necessarily that we would want to continue a separate programme of work, but for instance, in Cheshire and Merseyside, the Cancer Alliance have invested in a social action programme across the 9 places. So they are spending a considerable amount of money to invest a social action lead in each of the 9 places, based with the infrastructure organisation. Okay. To me, that feels absolutely like this programme.
Yeah.
And what we should be saying is, our learning's told us this: if you're spending money on these things, use this approach.
Lovely. So it kind of proof of concept, really, and it builds despite whether or not the money comes. Thomas, what do you think about that from the ICB perspective, and Samira as well from the community perspective?
Sorry, I'm coughing here. Yeah, no, I completely agree, and I think we need to really look at what are the insights and actually the information that comes through the conversations that connectors and other similar roles have with members of the communities. Like what do people actually care about? What are the priorities and what makes them happy and healthy and well, I guess. And I think I saw it in chats that somebody said it's often dictated by ICBs and by public health institutions of we assume that it is something that you need, and I think that's where we need to go away from a little bit, and I think it's really what again, as I mentioned it in my presentation earlier, my little section earlier, about what can people do for themselves, and what they know much better than that we do what can help them. So I think it's really being much more open to I think Sally, you mentioned it, like what can we fund that can make that change happen, I guess, for people. So.
Sure. And Samira?
Yeah, so I think, it wasn't that long ago during lockdown where we saw the power of community to deliver, and actually kind of the NHS and any public sector institution would not have survived without actually the support and the impact of local community and voluntary organisations, and as well as kind of the neighbourhoods. I think there's something to learn from that. I think for me, it's how do we not forget that? Because there was just after lockdown, lots of organisations, ICBs and ICSs, were saying, this is the new default position. So what happens in the system that actually kind of reverts back to type and actually kind of then goes back to, well, we need to make some savings at the moment. We know that actually there are lots of struggles in ICBs where they all have to make 10, 20, 30% savings. If that's the case, it's almost kind of that's the case for investing in community and voluntary organizations. That's the case for investing in these types of programs, because they're the only ones that are going to help you deliver on your long time issues. I think there's also something about co-commissioning. So the idea is that the ICBs cannot be the only people who decide what to commission and how to commission, or the priorities for commissioning. And I think there is something about actually there's a case for involving both nationally and locally, actually kind of co-commissioning provisions. Because I think unless we begin to do that, we're really going to actually struggle in the longer term to deliver against the requirements. Our health inequalities are widening. They're not actually reducing. If health inequalities are widening, then what is going on in the system? We can't keep doing the same thing and expect different results. That kind of old statement. And also, we can't really address the wider health inequalities without absolutely investing in the voluntary and community, especially in grassroots organizations, and also in actually kind of making sure that those organizations are given permission to do what they do well, rather than us dictating what happens or where the funding goes.
Thank you, Samira. That's absolutely very powerful, and that's two of you now that have invoked Einstein in this, and that quote. But I love your point that the reduction in resources and needing to spend less is the case for investing in community. And I think in this whole session, we've seen the power of the community and VCSF sector building, and I think that this hopefully will become unstoppable. I was going to ask our panelists, but I've run out of time, what one thing the national programme could do to support a sustainable handover. So that's the SCW and partners team. So can I ask delegates if you want to write something in the chat box about what one thing you think that the national programme leaders should do to support a sustainable handover to the ICSs, so that momentum is not lost and that this remains sustainable. And thank you to all our speakers. It's been absolutely excellent, and I've really enjoyed hearing you, and I hope delegates that you have as well. And I'll hand over to Sarah back over to end the session. Thank you.
Thank you all so much. That was really interesting to listen to. And yeah, please do fill that in the chat, answers to Maren's question there. Well, that leaves me to introduce the final speaker of the day. And the final speaker of the day is Mary Hill, who's the Head of Policy for Healthcare Inequalities Improvement at NHS England. And Mary, you've agreed to talk to us about how connectors can influence ICS's plans for health inequalities. So over to you. Thanks for joining us.
Thank you, and thank you for having me. And it's been so fantastic being part of the whole event today and hearing from everybody. And that discussion just now was absolutely fascinating. I'm really looking forward to seeing the answers there in the chat around what you would like to see from a national perspective on further funding for the programme and sustainability as well. So I've been asked to talk about how to influence ICS plans for health inequalities. So if we move on to the next slide, I think one of the key messages I wanted to share really with you is that Core20Plus connectors are absolutely central to our health inequalities programme nationally. We absolutely know that to make change on inequalities, we need to be involving people and communities and really pushing that cultural shift across the NHS around co-production, co-design of services from the outset, and moving to addressing health inequalities by default. And we can only do that with you, with people, with communities. Your local integrated care boards, your providers and primary care will all be aware of the Core20Plus5 approach. It's been a message that we've been really pushing over the last 3 years now, and continue to do so from a national perspective. And we've got some fantastic champions out there, yourselves included, now working all across the country. And we also have a whole ecosystem of people working around the Core20Plus5, including our ambassadors as well, who are people working in the system who we're really equipping with tools and knowledge around our key messages on inequalities, and also that evidence base of what's working and what they need to know and how they can champion the Core20+5 in the organisations where they're working. So what does this mean in practice? It means there's lots of opportunities to be able to influence those strategies and plans at the local level, at your local place level, and also at system level as well, so that bigger level. And there's different ways to do that. And I think there's different opportunities depending on where you are in the country and your interests as well, and how you want to influence. So if we move on to the next slide. So I wanted to share with you kind of a couple of ways, or a couple of kind of key areas you could be focused on, or some of the questions you could be asking, and some of those strategies and plans that you could be asking questions about of your local systems and of your local NHS organisations. So as a national team, we have recently published our framework for NHS action on digital inclusion, and this is very much around how we mitigate against exacerbating inequalities in terms of digital exclusion, in terms of how people access services, and ensuring that everybody has opportunity to benefit where they can from digital services, but if that's not appropriate, there are other opportunities as well to access your services. So we've come up with a range of areas of focus for both people and communities, and also our workforce too. We've also got our inclusion health framework, which we have co-designed with a range of partners on the call today, and with people with lived experience as well, around really addressing the needs of our most underserved communities and socially excluded groups. And again, we've published this framework for action on inclusion health with a range of domains and principles for our workforce and for our leaders as well. So again, this is about encouraging that cultural shift and some practical steps that our local NHS organisations can be taking. So I think there's opportunities there to be asking your local NHS organisations who's leading on these frameworks, on the implementation, who's going to be taking that forward, and what the plans are about embedding these frameworks. It's still very early stages because they've only recently been published, so in the early stages of that, but I think that means it's a real opportunity now to be asking those questions and getting involved from the outset. If we move on to the next slide. So I wanted to share with you a couple of the key areas where we have got opportunities to influence from a health inequalities perspective around some of those key local plans that are really driving the direction for your local NHS organisations. And there's different ways to be involved and different ways to influence, and some of them are going to be kind of different opportunities as well, but just really wanted to share these with you. So we have our annual operating plans or operational plans. We have joint forward plans. There are integrated care strategies. And a more technical one is we have section 2N of the NHS standard contract, which is around health inequalities action plans as well. So there's different timescales for all of these plans, and there'll be different kind of opportunities to actually inform and influence these. But I just wanted to call them out really around what we're asking local NHS organisations to do. So with the annual operating plans, these are usually developed between sort of December and March each year, and that really depends on when some of the national must-dos have been published. So this year, for example, they haven't actually been published yet, but this is the time of year where your local ICBs will be doing that annual planning and those must-dos. And in those must-dos in the last few years, we have made reference to the Core20+5 approach for both adults and children and young people, and really thinking about those annual milestones around how your local NHS organisations will implement the Core20+5. So those are the annual plans, and then there's joint forward plans. So these are a new plan. They were first published in June last year, and they are 5-year plans developed by the Integrated Care Board. And each year those plans will have the opportunity to be updated. And this is moving to the same sort of cycle in terms of timing as those operational plans. And in the joint forward plans, there's reference in there to our health inequalities legal duties. So again, it's about asking those questions around the health inequalities focus in those joint forward plans. And we've got some really interesting analysis actually that we've been undertaking with colleagues at SCW, CSU on the current plans around where people are focused on inequalities and where they might be able to strengthen their focus as well. Then we've got the integrated care strategies. These are the wider partnership strategies with working with voluntary sector, working with local government, linking into health and wellbeing boards. And so these strategies, again, have got that health inequalities focus within them. They're longer term. And they very much also talk about health disparities as well. So you might hear the disparities terminology, but it is looking at inequalities. So again, it's about looking at those opportunities to engage there and finding out a bit more about when those strategies get refreshed, because it's a slightly different timescale and linked to when your local joint strategic needs assessments may be updated. But again, it's a big plan and a big focus of the integrated care partnership. So again, that opportunity to influence. And then the final one was the NHS standard contract. And I mention this because it is quite technical, but actually there is the opportunity in there to have a health inequalities action plan, which is talking about the data, the health inequalities data, collected and analysed by your provider organisations. And it also includes in there reference to engagement, how they're engaging on those action plans, and also that Core20Plus5 approach. So there's a range of plans there that there is opportunity to influence. And I think the points earlier in the panel session as well, it's about being accountable to local communities. So I think reaching out, asking these questions in the relevant forums is absolutely the right thing to be doing, and ensuring that the kind of approaches that we're talking about here, the model of engaging with people and communities and those trusted community partners being the centre, and that parity of esteem as well around voices as well as the data, really influencing these plans. So if we move to the next slide, I'm mindful of the time, so I will be wrapping up soon. But the points I wanted to leave you with, really, I don't want to be teaching anybody to suck eggs here, but it's finding out who those local leads are, where are those engagement forums. Many of you are probably already involved in a lot of the local forums, and with your Healthwatch partners, your voluntary sector partners, local VCSE alliances as well. What do those integrated care board engagement plans and involvement plans look like? And can you be asking those questions around who's leading on the health inequalities elements of those plans and strategies? And there's some key leaders there that will be involved. There will be a health inequalities senior responsible owner or officer in all those NHS organisations. So how are they pulling this all together? How are they monitoring and kind of demonstrating their impact, really? And I think the point earlier as well about the funding, again, absolutely vital, that health inequalities funding as part of ICB core allocations. How is that being spent locally? And it's asking those questions. And again, that local level accountability around the funding. So I'll come to my final message now. What I really wanted to say was, I think Bola made a really strong case earlier. It's about the connectors are very much around translating policy into something meaningful. What you're doing from the ground up is absolutely fantastic. And that's where the change is and will happen. So we've got a real cultural shift that we need to kind of embed in the NHS, I would say. So it's about asking those questions. There are a range of plans and strategies that can be influenced, and they're developed at different levels. So it's about how you want to be involved. And that might take different forms. It might be surveys, it might be citizens panels, and it might be engagement events. It might be on a specific service. It might be something around a Who's Shoes event, where you're really looking at people's experiences of a service and those next steps. And yeah, so lots of opportunities, I think, to be involved. And it is very much around kind of looking ahead around that cultural shift. And you are absolutely core to delivering that change and demonstrating that impact.
Thank you so much, Mary. Thank you. That's a really nice note to end on. Fabulous. So that brings us almost to the very end of the event. There are two very hopefully straightforward things I want to ask for you to do before we finish up. And the first one is to take part in one final Mentimeter of the day. We'd really like everyone here to commit to taking one practical action that they're going to do, that you're going to do, to take to address health inequalities after today's event. So if you want to just pop your commitment into the Mentimeter, that'd be fabulous, and we can just see the different types of things that people are going to commit to. I think the second thing that I'm going to ask you to do as well is just, I hope it comes across. We've put in a lot of work today just to make this event come together and hopefully cover lots of topics that are of interest to you, but we know that they can always be improved as well. So we've got a feedback form that we're going to pop in the chat. So if there's any future events like this for connector sites and for connectors particularly, then please do give us any feedback about the types of things you'd like to see covered within that. As these responses kind of come in and pop up on our screens, in front of me, I just wanted to say some thank yous. So just a huge thank you to everyone who's attended today's event. Thanks for being so active. Thanks for humouring me when I've asked you to do slightly funny tasks. And thanks for being so engaged with all of our speakers. That brings me to the next point, to all of our speakers. Thank you so much for sharing your experiences, your ideas, your advice, your stories. I've learned a lot today, and I spent a lot of time in the health inequality space, but I learned a lot from the conversation. So just thank you for being so generous with your knowledge. It's so appreciated. I want to say a special thank you to NHS England for funding the work of the Connectors Programme and for supporting this particular event and getting it off the ground and making it happen. I want to thank SCW, who've been taking the lead on some of the delivery around this, and also to the Health Creation Alliance. It's been great working with all of you on this at National Voices, so we really appreciate that. I want to say a really special thanks to Pavi and to Grace from National Voices, who've been doing all the tech today. And I know we had some issues early in the session. They really rapidly were able to mobilise and resolve those. So just a huge thanks to Pavi and Grace for that. I'm just looking at the screen here, some amazing commitments here, reviewing some of the examples of approaches, recruiting more connectors, finding out about leads in NHS in the local area, being more active in conversations around health inequalities funding, identifying some voluntary sector organisations locally and building relationships. That looks wonderful. Thank you all for making those commitments, and we'll have a little look through them and see the full kind of breadth of things that are in there. So that brings me to the really final point, I promise now. Sorry, the feedback form will be posted in the chat if it's not already, so really appreciate if you would follow that. And yes, it's in the chat, so it is. So take 2 minutes after the event for that. But just thank you all so much just for the incredible work that you do to tackle healthcare inequalities. I mean, I found it really moving to hear so many of the examples today of how people have taken their own stories, often where they've experienced inequalities themselves, and they're committed to making sure that doesn't happen to anyone else. And just, yeah, it is really powerful stuff, and the things that you do really make a big difference. So just thank you so much for that, and thanks so much for joining in, and I hope to see you in a conversation like this soon, and I hope to hear about the impact of the work that you're having and the progress that you've seen, and just best of luck with it all. Thank you now. Bye-bye.
Thank you. Thank you.
Have a lovely evening.
Thanks, Sarah. It's great.